The next wound care that we're going to do is going to be for a nosebleed. An individual has a nosebleed. Again, for make sure that we have our gloves on. When we come up to the victim, we want to grab some gauze to help collect some of the blood. Now, another thing that we want to remind the victim is that while we're collecting the blood with our direct pressure, we want to instruct the victim not to tilt the head back, but she can, while we're applying the direct pressure, she can tilt her head forward. So go ahead and do that. Go ahead and lean your head forward. Okay, so I can either keep the direct pressure, or if she was able to, she can do this herself. Okay, to control the bleeding. Again, until it stops. If we need to add more gauze to this, we can do that. Again, you need to be careful with pulling away the gauze for the first layer, like our other wounds. Once we think we have the bleeding under control, one of the items that we can use is a nose plug. These are about an inch or a little inch and a quarter length nose plugs, which can be inserted into the nose. Another extra technique that I've seen is I've seen some people apply a couple drops of eye drops on there to help it anticoagulate a little bit better. And then what we would do is we would ask the victim to slowly put this up the nose. Obviously, we won't do this for real life, but it would need to stick out a little bit, so obviously we can remove it later on. But she can return to play with the nose plug in. Another thing that you want to check for is any signs of head or eye trauma that might, if they were in a fight or some direct blow to the nose, that there might be other injuries around there. Maybe another simple technique that you can do if you wanted to make your own real quick. This is a 2-inch gauze. If you didn't have the nose plug, you could probably make one pretty easily by just rolling the gauze up again into a little 1-inch tube, and again applying, again, depending on the size, you may not need it that big. And then again, you can use the same type of a technique by keeping her head down. She would twist that into her nose and letting it stick out a little bit. Another thing that you can do is you can, obviously you can make sure that you're applying direct pressure. Instruct the patient to make sure that that she refer to a doctor to see if there's any nasal fractures or other injuries to the area, and as well as if she cannot control the bleeding with the nose plugs or other methods, to go to the hospital so that they can use their techniques to stop the bleeding. Ice is another technique that you could use. Again, you could put a small bag of ice on the bridge of her nose if you needed to, as well as help control the bleeding. So, and that is it.